Hi, this is Dr. Nyla Fleming, and welcome to my quick review on common neonatal conditions. I've chosen to put together this very quick video for you guys because after looking through the course material, I want to make sure that you guys don't skip over this important section. I've created the PowerPoint and then done a voiceover because I know that you guys have different learning styles, and I want to make sure that I incorporate both learning styles into this review. So for those of you who like PowerPoints, the PowerPoint is attached. For those who like to listen, you will be able to listen to this in your car, or you can listen to this during your study time. First, we'll start with common skin conditions. The first one we'll look at is called milia. Milia is a firm, pearly white papule that covers the cheeks, nose, and the forehead. So if you take a look at the picture on your left, you will see that these papules are a pearly white color. The diagnostics for this is nothing. It is based on clinical presentation. The treatment for this, again, is nothing. It will resolve spontaneously on its own, typically within the first few weeks of life. So most of the treatment here is honestly reassuring your parents that nothing is wrong with their baby and that this will go away on its own within a couple of weeks without them doing anything. Next, we'll look at sebaceous hyperplasia. Sebaceous hyperplasia is a yellow-white papule that will be on the cheeks, nose, and forehead. There's no diagnostic testing needed. Again, this is based on the clinical presentation, and the treatment for this is that it will resolve within the first few weeks of life, and you don't have to do anything. The treatment for this, again, is reassuring the parents. Next, we'll look at erythema toxicum. This usually develops within the first 24 to 48 hours of life. You will see firm yellow-white papules. The difference here is that it will have an erythematous base on the cheeks, nose, and forehead. The diagnostic for this is something called a Wright stain, and it will demonstrate a large number of eosinophils. The cultures are sterile. The treatment for this is parental reassurance, so there's nothing. It'll clear on its own within 2 weeks, and it'll be completely gone in 4 months. So in a couple of weeks, it gets better. It's completely gone by month 4. We'll also look at transient neonatal pustular melanosis. The risk factor for this is darker skin. So you will see this more in your African American babies. These are vesicular pustules. They will rupture easily and they will leave behind a halo of white scales. There will be also a hyperpigmented central macule. This macule will be on the trunk, limbs, palms, and soles. There is no diagnostic testing needed. The treatment for this is nothing. It'll resolve on its own within 2 to 3 days, but it's very important in your anticipatory guidance with your parents that you let them know that there will be hyperpigmentation that can last for up to 3 months. Next is a sucking blister. This is due to rigorous sucking in utero. You will see a scattered superficial bulla on the upper arms, lips of the newborn. There is no diagnostic testing needed. The treatment for this is it will resolve on its own within a couple of days, but there may be hyperpigmentation that can last for up to 3 months. So again, your big treatment here is parental reassurance. Next, we'll look at cutis marmorata. I hope I pronounced that correctly. But you'll know this when you see this, and many of you have probably seen this in your own infants or with just caring for patients. This is a lacy reticulated red or a blue cutaneous vascular pattern. It covers most of the baby's body, and this is a response to cold. There's no diagnostic testing that is needed, and the treatment for this is warmth. So when you warm your baby, this will go away. Harlequin color change is something else that we need to be aware of. This is a yellow, hairless, smooth plaque on the forehead or neck. There's no diagnostic testing needed. This is based on the clinical presentation, and the treatment for this is nothing. It will resolve, and you will need to reassure your parents that this will resolve on its own. Next, we'll look at nevus sebaceous. This is a yellow, hairless, smooth plaque on the head or neck. There is no diagnostic testing that is needed to diagnose this, but the treatment is something that is very important and it's not something that you should ever miss. The treatment for this is going to be a total excision of the lesion before adolescence. So when you see this in your infant, you need to refer them on to dermatology. If this is left untreated, by adolescence, they will develop large rubbery nodules. I encourage you to Google some images on this so you can see what it looks like. And by adulthood, the risk is cancer. So malignancy can develop. The most common malignancy is basal cell carcinoma. Next, we'll look at the herpes simplex virus. The risk for developing this is if the mother has an active lesion or a history of herpes. The presentation is group vesicles with an erythematous base. There is some diagnostic testing that is available for this, and the treatment is acyclovir. Mongolian spots is something that you should always be aware of in your infants. And I've taken the boards twice, so I have more than one board certification. And on both of my boards, I was asked about Mongolian spots. And you actually see it quite a bit in clinical practice as well. So just make sure you keep this on your radar when parents have complaints about skin in their kiddos. It will present as a blue or a gray slate colored macule, so this is flat. And it's usually located in the presacral or lumbosacral area on darker skinned infants. So the key here is the darker skinned infants. You will see this more in your African Americans and people of Mediterranean descent. This lesion will typically fade on its own with time, and it is not noticeable by adulthood. Now we're going to look at some birth traumas. And as we all know, as nurses and healthcare providers, that birth is actually a pretty traumatic experience. So it's not an easy process, which is why they call it labor. One of the things that can happen is something called Cabot's succedaneum. And forgive my mispronunciation if I pronounce that wrong. This is diffuse swelling of the soft tissue of the scalp. There could possibly be some underlying bruising. The swelling usually crosses suture lines, so that is very important to remember that. And this is due to trauma as the baby descends into the birth canal. The treatment for this is nothing, and again, we got to remember knowing our clinical and diagnostics is part of being an advanced healthcare provider. So you need to know what the clinical presentations of many things are, because sometimes there's just not a test for it. It's just your clinical knowledge. This will resolve on its own within a couple of days. And risk factors for this are first-time moms and also a traumatic birth. Next, we'll look at cephalohematoma. This is a collection of blood under the scalp. It does not cross a suture line. That's important. It doesn't cross the suture line. There's typically no bruising, and this will develop within hours to days after birth. And this is due to the trauma of a difficult delivery. There are some respiratory conditions that you should be on the lookout for. Transient tachypnea of a newborn is a big one. This occurs when infants are delivered at or near term. The cause is incomplete evacuation of fetal lung fluid. Clinical findings with this are your infant usually is not cyanotic, there are no rales, and there are no rhonchi. This will usually resolve within 24 to 48 hours after birth. A chest x-ray should be completed, and this will show some perihilar streaking with a slightly enlarged heart with fluid in the fissure. The respiratory rate gradually decreases within 72 hours, and the treatment for this is you want to maintain their oxygen saturation rate. I also want you guys to take a few moments to go back and look at infant distress also in your book. We can also look at some GI disorders here. We'll look at two. The first one we'll look at is Hirschsprung's disease, and this is from an absence of ganglion cysts in the bowel wall, most often in the rectosigmoid region. What happens in this is a portion of the colon has no motility. This affects 1 in 5,000 live births. The most common cause for this is colon neonatal obstruction. It tends to run in families. It is more common in males and is also common in trisomy 21. Symptoms that you will find, so always be aware of what the clinical presentation is. There will be a failure to pass meconium within the first 48 hours, failure to thrive, poor feeding, chronic constipation, vomiting, diarrhea, explosive bowel movements. We can also do an x-ray, which will show dilated loops of bowel. That dilated loops of bowel found on x-ray is important for you to know. A biopsy can be conducted, which will show an absence of ganglion cells, and the treatment for this is surgery. So you need to make sure you refer these patients on. Now we'll look at pyloric stenosis. Pyloric stenosis is a narrowing of the pyloric sphincter due to hypertrophy of the pyloric muscle. This affects about 3 in 3,000 live births. It is more common in Caucasians and firstborn males. Symptoms of this are regurgitation, non-projectile vomiting in the first few weeks of life. Then it will switch to projectile vomiting in the second and third week of life. Other findings will be insatiable appetite with weight loss, dehydration, and constipation. Physical exam will show, possibly and very likely, that you will palpate an olive-sized mass in the epigastric area. The olive-sized mass is important, and this is something that will help you quickly distinguish this condition. The diagnosis is based on an ultrasound, and we will also do radiographs, and you will see something called a string sign, which I have included for you here. And that's it, guys. So if you have any other questions, please let me know. I will be more than happy to answer any questions that you may have. If you find this type of review helpful, let me know. If you don't, let me know. I'm here to serve you guys, and best of luck, and my prayers are with you for this exam in a good way.